Hey everybody, it's me, Ashley of Day-to-Day Social Work. I'm a private online tutor and I specialize in assisting people to pass the license exam in social work on the master's and bachelor's level, and I'll soon be going into specializing in the clinical level once I take my clinical exam, hopefully in the next 2 months or so. Day-to-Day Social Work is about all things social work, including license preparation. That's the primary reason that day-to-day social work was started. And then, of course, if you've been following for any amount of time, dropped my glasses. For any amount of time since day-to-day social work was started in 2015, then you know that there is also a lot of other information on this channel about just social work in general, things that you need to know as a social worker, social work related topics, and that kind of thing. So today I wanted to come with another video, and I'm going to be using and referencing this little booklet that you all can get from the NASW. It's the NASW Standards for Social Work Case Management. And so we're going to talk specifically today about record keeping, which is standard number 10. And again, so there are, let's see, if I can get the pages to come apart, or maybe they're not supposed to come apart. Okay, so there are 12 standards for social work case management, and they are ethics and values, qualifications, knowledge, cultural and linguistic competency, assessment, service planning, implementation and monitoring, advocacy and leadership, interdisciplinary and interorganizational collaboration, practice evaluation and improvement, record keeping, workload sustainability, and professional development and competence. So I feel like I had planned to do a video on record keeping before, but I don't think I actually got around to it. I think that I probably mentioned some stuff about record keeping in several videos, but I wanted to make a specific video on record keeping because documentation is one of the main things that we do as social workers. And if you didn't write it down, it didn't happen. If you didn't document it, it didn't happen. So that's why I really wanted to come and do this video. And then I might just do some videos on some of the other standards. But because I had to present on this for work before in one of our social work staff meetings, I already had notes on it. And so I was like, I'll make a video about this because I already have my notes taken. So just to go straight from the book, straight from this little pamphlet or book, standard number 10, record keeping, it says the social work case manager shall document all case management activities in the appropriate client record in a timely manner. Social work documentation shall be recorded on paper or electronically and shall be prepared, completed, secured, maintained, and disclosed in accordance with regulatory, legislative, statutory, and organizational requirements. So definitely we know that we have to document everything, and it has to be in accordance with your job's regulations, your agency or your company's regulations and policies, legislative, whatever your state's legislation requires. You know, if you may be subpoenaed to court or asked to testify as an expert witness, you may need to have documentation on hand of certain situations and clients and cases, that kind of thing. Statutory and organizational requirements. So according to your organization or agency, company, program, what those requirements are. Okay, so let me see. I don't want to read directly from the book because, like I said, I had already made my own notes from this book. But let me see. Yeah, my notes are pretty much, and the thing that I'm gonna do, I don't know if you can see it. So it's standard number 10, and it's only like a page and a half, so this video won't be long. Okay, so let me get to my notes here. All right, so and this will just be me freestyling. I don't have anything in particular that I have written down as far as what I want to say other than my notes. So, of course, let me let this load. It's loading up right now. I hope y'all have had a good day while this is loading. I'll just say that today for me was a really busy day. A lot of referrals, a lot of kids with a lot of challenges. So I'm mentally drained. Like people always say, you don't do any manual labor, you don't do any physical work, but mentally it can't, like, you can literally feel physically exhausted after a day like I just had. And I kind of feel exhausted. So I'm probably gonna have some ice cream. Why is this thing not loading? Okay, I'll just read it from here. But yeah, I'm probably gonna have some ice cream and chill out and catch up on some shows. I have to watch The Chi. I didn't get to see the finale, but anyway, I'm rambling. Okay, so now let's go ahead and talk about record keeping. So of course, and as I've said this in plenty of videos before, we want to make sure that our documentation is clear, concise, and ongoing. So you want to make sure that you note clearly what's happening, especially if it's and again, this is for case management. So a lot of times when you do case management, we know that this is an ongoing process where we see our clients on more than one occasion. We may see them weekly or bi-weekly or monthly or every 3 months or whatever, but it's an ongoing process. So you want to make sure that your notes are clear, concise, and ongoing. You want to make sure that whoever comes next after you has a good picture of what's going on in the case, and that there is little to no question to be asked because your documentation is just that great. You want to be as cohesive as possible. So you're kind of telling the client's story. And so if you have a database or a system that allows you to track your notes as the time goes on, which I think a lot of agencies do, when you look back at your notes and you pull in your notes from the time that you started with the client until the present time, or once you've ended the client, from the time that you started until the time that you ended, there should be a clear story of what happened from the opening of the case until the closing of the case. So I think especially in the beginning, you want to note like different physical things about the client. So, what their demeanor is, what they present like, what their mood is. You want to get a baseline and you want to describe that in your initial note. And then as the time goes by while you are working with your client or clients, then you want to continue to draw that picture and have, if the client's mood and demeanor changes throughout the time that you see them, you want to document that, especially if you're working in a setting where it's focused on mental illness or mental health. And then also if you're just working maybe in a residential setting, or if you're working in a school or prison or wherever you're working, you still want to draw that picture of the client's affect, mood, and demeanor. So make everything cohesive as possible so that when somebody starts your chart, say you started working with the client in January 2018 and they are here today, August 26th, 2020, we want to be able to see how that client has grown. Have they been stagnant? Have they had a high and then they came back down? The ebbs and flows of the client's life during that time as it relates to your contact with the client. Next, documentation serves as a foundation for service planning and practice and program evaluations. So, of course, as I just said, it serves as a foundation for service planning, which is a treatment plan. So when you first meet the client, we know we've assessed the client. That's that foundation. We see what the client presents like and what we're going to work on. We're going to come up with a treatment plan with the client, set goals with the client. Normally the client should be the primary person setting their own goals, and you're just assisting with that. And you want to make sure that that's laid out plain and clear. And then also when it relates to program evaluation, that kind of means, like, especially if you're going to get audited, if your charts are going to get audited, you want to make sure that the auditor knows exactly what is going on. Because if the auditor comes and audits your chart, They need to be able to see what you've done with the client, especially if they are providing grant money to your agency. Then they definitely need to see if their money is going to where they sent it. So a lot of times when you get a grant, specific funding is allocated for certain services within the program, and they need to make sure that that's documented, that the clients are receiving those services provided by that funding. Then it says updated records support support in case of legal review. So you want to make sure, of course, like I've been saying, that you keep the record flowing, that it's ongoing and updated. Because if there's a legal review, such as a subpoena, as I just mentioned a few minutes ago, you want to make sure that your notes are on point, because if you didn't write it, it didn't happen. So that's important. Communication with other service providers. Your notes serve as your voice when you can't speak to other service providers. So if I was referring a client to a different agency and I needed them to see exactly, of course, you're going to give them a summary of what's going on, but you're not going to tell them everything that's going on or has gone on with the client. So of course, you want to make sure that you document your notes in a manner that speaks for you as the social worker as it relates to the client, so that you can tell the client's story in a beneficial way that will help the next service provider be able to help the client without the client having to retell their story, especially if they have something traumatic going on. You don't want your clients to have to keep telling and reliving their trauma. So if you've done an assessment and you've documented it correctly, then you have all that information in your assessment, in your notes, and that will then help the next service provider. So it's kind of like an interdisciplinary team kind of thing. So you want to make sure that you also, a lot of times we want to use social work jargon, just like doctors and nurses use medical jargon. There is a such thing as social work jargon, and it might be specific to your location. But you want to make sure that you spell out acronyms and stuff like that. It's kind of fun. Like for me, when I started working in the medical setting, I would see all this medical jargon and I'm like, what does this mean? What are these acronyms? And I would just get a little like frustrated because I'm like, clearly I'm not a medical person, so spell this out for me. But then I started thinking about how we have some acronyms and stuff too. So I would put those in there, and it's not to be tit for tat, but sometimes you just automatically use, and I guess that's how they are too in a medical setting. They just automatically use their own jargon. But I'm very mindful though, that everybody doesn't know what my acronyms mean. So I like to spell it out initially, and then I'll put in parentheses the acronym, and then I'll continue to use the acronym after I've spelled out initially what the acronym stands for. So then it says documentation must reflect informed consent to all aspects of case management. So of course we know that we have to get informed consent to treat a client and to provide services to a client, written informed consent, and that needs to be in the case note that the client has consented to all aspects of case management. We want to get informed permission to treat the client. We must make sure we keep all information confidential. So that's very important too. There are lots of ways that we document. You may document on paper, you may document in a database, you may document on your personal, well, not your personal, but your work computer. You may document through text messages. So anything that you document on needs to be under lock and key and encrypted. So if you are documenting on paper, which is kind of outdated now because of all the information management systems that we have now, but if you are documenting on paper, you want to make sure that you have your files locked away where there is no access from anybody except the people who need access to the files. So you want to make sure that your files are always locked. I worked at one place where we did use paper, and we had the manila folders, and we kept all of our case notes on paper and put them in the manila folders in a file cabinet, and we had a lock for the file cabinet, but we would leave the cabinet unlocked throughout the day because we were there were like 4 of us caseworkers at the time going into and out of the file cabinet to pull charts and do case management, document our notes, and then put the chart back in and get somebody else's. So we would keep it unlocked because it was in one of our offices, and we had a key and somebody was always in the office. But if you don't have someone always in the office and can make sure that the files are secure, you really need to make sure you lock the file, even though you may be comfortable in your environment and your surroundings and you don't think anybody's going to go into the chart. But the place that I was working at was very open. Like, I could go to the restroom and be gone for 5 minutes, and a client, it was a residential place, could easily come into the office without me knowing, and go inside of somebody's chart to be nosy and see what's going on because somebody may have got written up or whatever. So you want to make sure that everything is under lock and key, even if it seems like an inconvenience to lock the file just because you're going to the restroom for 5 minutes. If you don't have a staff person on site and watching that file cabinet, it needs to be locked. And then also with the information management systems and the telephones and the computers, of course, I'm pretty sure your agency has some form of a computer-based training or annual computer training or whatever kind of trainings that tells you, according to your agency, how to encrypt files and how to send emails and how to make sure that you use screen protectors, make sure that you have those little computer locks to keep your computer locked down to your desk, and make sure you use strong passwords with numbers and letters and special characters, all of that kind of stuff to keep everything as secure as possible. You want to make sure that your phones have passcodes or face recognition or thumbprint, fingerprint recognition, and those kind of extra layers of protection so that we can keep our clients' information confidential. And then also you want to make sure that if you have a work phone or a work computer, that you don't let your family and friends use those devices because it has your client information on it. Okay, so reflect clients' involvement by including quotes, stories, goals, and feedback from the client. So that's important because, like I said, you're telling the client's story according to your interactions with the client since you've been treating them or seeing them or whatever. So you want to make sure that you add quotes. And I love adding quotes into my notes because, and you have to know what to quote. So make sure that if a client said something important that kind of tells about how their mental health is at the time, make sure you document that. If the client was excited and they said something that's relevant to your treatment, you need to put that in quotes. You don't want to go quoting everything that they said, but if a client is getting a divorce and the client tells you that they have been drinking to cope, but they only have 10 beers a night and is no problem, you want to quote that they said they have 10 beers a night because that probably is a problem. And then you want to be able to pull that back out and say, hey, I know you said you don't have a problem, but Tuesday when we talked, you said that you drink 10 beers a night, 7 nights in a week, that's 70 beers. So, and if the person is then mandated to go to some kind of alcohol rehab or something like that, you can send that note over to that facility. As we discussed a few minutes ago, it tells the client's story without the client having to retell their story to the new people that you're referring them to. And the client will, or the staff person there or the therapist or counselor there will be able to see in your note that the client said that they have 7 beers a night. So that's a problem in most instances, if you ask most people in the healthcare field. So that's important that you use quotes, stories. You want to capture good stuff too, not just the bad stuff. If client success, testimonials, that kind of stuff also. And then, of course, goals and feedback from the client. So if the client's telling you that they don't feel comfortable talking to a therapist, every week, you can document that. And so the next person who has the client can maybe refer them somewhere where they only have to go every 2 or 3 weeks instead. So all of this is important stuff. Everything that happens is important. Okay, so it's include, these are the following things you need to include, and I'm not going to go through them one by one and break everything down because it's pretty much self-explanatory, but get my glasses because this blue light definitely has my vision blurry at 33. So I never thought I would be wearing glasses, but I try to keep remembering to put them on because of the blue light and my blurriness. But anyway, so you want to include the following 11 kind of items. So identifying information, dates, times, descriptions of contact with client, family systems, service providers, and organizations. So I already stated that in the beginning that you want to put that identifying information, their demeanor, and as far as identifying information goes, their gender, their and along with that, their pronouns and what they identify as male, female, transgender man, transgender woman, whatever they identify as, you want to make sure that that's included in your documentation, what their preferred name is, dates, of course, times. Some agencies require you to put times like by the 5s or the 10s, so 10:05 or 5:15. And then for me personally, if it's 5:18, I'm going to put 5:18 in my note if I'm doing something at 5:18. You don't have to be that specific, but I just am. Descriptions of contact with the client, of course, that's just automatic. Contact with the family system. So if you are working with the client and you end up talking with the client's sister, brother, mother, uncle, aunt, and they give you relevant information, you want to make sure you list their name and the relationship to the client so that if someone has to call that person, they know who they're asking for when they call and what the relation is, as well as why they're calling that person, what information and the relevance of that person being involved. And then any other service providers and organizations that the person is involved in or involved with. So if you're going to make a referral to counseling or something for someone, you want to make sure that if to your knowledge, the person has been to counseling before in another agency, you want to make sure you put that in the referral. And you also want to document that in your initial assessment note. So that was number 1. Number 2, the client disposition and demeanor. We already talked about that. Number 3, initial and subsequent psychosocial assessments. So we talked about that initial assessment. A lot of times agencies require for you to follow up with the client every 6 months or every year, or sometimes more frequent than that. So whatever it is, you want to make sure that you have that initial assessment and the follow-up assessments, because that will give you some comparison, a way to compare what's going on with the client's growth, if the client is stagnant, if the client has reverted back to old ways, or whatever the situation may be. Get back to my document here. Number 4, treatment plan and procedure to monitor progress. Same thing we already talked about, of course, the goals, the treatment plan, and how you're going to monitor the client's progress. So are you going to follow up with the client every 2 weeks, every month? You're going to do a phone call, you're going to do an in-person visit at the house, or are they going to come to your office, that kind of thing. Number 5, services provided and the outcome. So again, if you are referring them somewhere, if you're referring them to apply for SNAP or Medicaid or therapy or whatever it is, you want to document that and what the outcome of that was. Did they actually apply and get approved for the food stamps and the Medicaid and all that kind of stuff? Or did they not? And if they didn't, then why not? Did they follow through with a referral to therapy? Did they go to that initial appointment, and were they scheduled for regular follow-up sessions with the therapist after that initial appointment. So those are the things you want to make sure you document. Number 6, referrals to and from other providers, organizations, resources, and reasons for those referrals. We already went through that. Number 7, supervision SALT. So this is if you call to your supervisor for whatever reason. Let's say that you have a client you've been working with for, I don't know, 6 months or whatever, and something comes up where the client has a breakdown or something and you don't know what to do. So did you call your supervisor to get some feedback, to kind of brief the case and see what your supervisor suggested for you to do? That kind of thing. So anytime you seek supervision, whether it's from your supervisor, a colleague, a coworker, a peer, whoever, and for those of us who are under clinical supervision for our advanced license, I don't know what your specific policy is, but you may even be able to include that. But for me personally, I talk to my clinical supervisor about my cases, but I don't give any identifying information. And I don't document in the chart that I talk to my clinical supervisor. Now, this is not my actual supervisor at work, but my clinical supervisor who's supervising me for my advanced license. I don't put that in the chart because I don't give him identifying information and I don't give him the full details of what happened with the client from start to finish. It's just if something happened where I just need to see what his thoughts are about what I did, then we discuss that, but it's not relevant to the client's care or anything like that. And I don't identify the client, so I don't put that. But for my actual supervisor who I work under in the organization that I'm employed by, I always put that I talk with the supervisor about, if I should make a report to DSS or if, I should schedule a home visit and all that kind of stuff. And when you do home visits, you want to make sure that you let your supervisor or your colleagues or somebody know where you are, what the address is, especially if you're going by yourself and you want to document what happened when you were there. Okay, so let's see. Number 8, reason for transfer or termination of services. So if you are going to transfer the client to a different social worker or a different agency, or if you're going to stop services altogether and you're not going to see them anymore, you want to document why. And if you transferred them to someone else, you want to document who that person is, what agency they work for, and why, as well as the contact number in case that is needed from somebody else who's in the chart later. Number 9, permission to release and obtain information. So that, of course, we already talked about. When you initially start treatment, you want to get that release of information, that informed consent from the client to treat. And then also, if possible, you want to see if during that initial, during that paperwork in the initial meeting or early on in the relationship, you want to make sure that you get release of information, permission from the client to share and obtain information with other agencies or other people within your agency in different departments. And you also need to make sure that it's age appropriate, because in some states, sometimes children especially can make their own medical decisions. Here in South Carolina, 16 is the age where, sorry about that. 16 is the age where a client is able to make their own decision on their medical treatment and stuff like that. So you want to make sure that that is noted, that you understand that you get age appropriate consent. Number 10, compliance with confidentiality and privacy rights and responsibilities, and that is HIPAA. So make sure you know the HIPAA laws, which I'm pretty sure that all of us are aware of. Make sure that we know that. And then number 11 is the case manager's signature and date. So you always want to date and sign when you are working with the client. each time you document a note, you want to put the date and sign it, whether it's electronic or manual. So let's see. Those are the 11 things you want to make sure you're including your documentation. So then I also put on here, follow your organization's requirements for record keeping and licensing jurisdiction as far as the type of data collected, the manner in which it was recorded, with whom and under what circumstances information may be exchanged. For my organization, even though we all work in the same system, there are different departments. Of course, it's a hospital system. And sometimes, even though I'm a social worker and I deal with a lot of mental health challenges with my clients, sometimes they will see psychiatry and some of their notes are blocked and I don't have access to it. So there's a thing we call breaking the glass, and you have to break the glass to see certain information. And if that information is not relevant to my job, I should not be breaking the glass. But if it is, then, and you have permission from your agency, then you can. So that would be one of the ways to look at that statement as far as the manner in which the data is recorded and with whom and under what circumstances the information may be exchanged. So I can't, like I said, if it's not relevant to my job, there's no reason for me to be in that chart. And so under that circumstance, I don't need to see it. But if it's relevant to me, if I've been working with this client because they're depressed or anxious or, having thoughts of self-harm, then it may be beneficial for me to break the glass and see what was said in the psychiatry appointment. Let's see, processes for amending the client's record, length of time the records are retained, and plans for proper disposal of the record. So you need to know the process for amending the client's record. So of course you don't want to go in and keep amending or editing the client's chart, because it starts looking like you are changing up information and being fraudulent. And so you don't want to look fraudulent in your organization. So try to make sure that you are documenting correctly. But if you have to amend the client's record, make sure you know what the process for that is in your agency and that you don't do it often, because it doesn't look good when they are auditing your charts. The length of time the records are retained and the plans for proper disposal of the records. So in most places, well, I won't say most, but in most places that I've worked for, 7 years is the length of time that a lot of places will keep the record before they dispose it. And you want to make sure that there's proper disposal. So an agency that I worked for before, it was 7 years, and most of their records at the time were paper records. And so they would have a bin where they would shred the records. And I know that some agencies have a company come and shred all of their stuff. So they keep all of the things that need to be shredded in a locked box. And then when that company comes once a month or once a week, they come and empty that box and shred all of their stuff to make sure it's properly disposed of. And then also you want to make sure that you explain to your client the limits of confidentiality, that if there's any abuse or neglect suspected, threats of harm to others or self, or if there's a subpoena, that you are required by law and mandated by law to make a report and to give up that information without the client's consent. Explain limits to client at onset of working relationship, written and verbally, so that they understand and can have informed consent. Include info on how the organization responds to the client's request of the client's confidential information. So the client has a right to their information too, but different organizations have different policies on how to give that information to the client. So the client may have access to their record, but maybe not the full record, or there are certain processes they have to go through to get the record. So make sure you know that, and you inform the client on how they can get access to their own record. And then some places, like when I worked at the police department, the public had access to some information. They call it the FOIA Act, I think it was, and I can't remember what the acronym was for, but the members of the public could get access to records or incident reports and see what's going on in the community. So make sure you know how the community can, or if the community can gain access to records, and if so, how, and what that process is. And you also want to make sure that people know that if they're going to disclose stuff to you, that you are mandated by law to tell some stuff. Going back to the mandated reporting part of it, your clients might get a lot comfortable with you and decide they're going to tell you everything they've ever done and all this stuff. They need to know for sure that certain stuff that they tell you, you are required by law to report. So they want to be knowledgeable of that before they start telling you everything that they've ever done. Seek consultation before disclosing information not covered by the client's written release. So if the client, if an agency is requesting information that's not covered under the written release, you want to seek consultation before you disclose that information. So that's that. I know it was a long video. I was trying to keep it at 30 minutes, but we're here at 36 minutes. So hopefully that's good information for you. I know it's a review for most of us, but again, there are some people who are still studying social work on a bachelor's and a master's level that follow this channel. And then there's some people who are master's level and bachelor's level, and it's just good to have a refresher about documentation, a reminder, so that we don't slack off on our notes and stuff like that. So hopefully the video was helpful for you. Please like the video if you thought that it was helpful. Subscribe to the channel, share the channel and videos with your colleagues and friends and family, or anybody that's interested in social work. And please remember that the 75-day pre-recorded tutoring series is on special for only $95 until further notice because of the pandemic. The regular rate is $175, but because of the hardships that most people are facing, I'm going to keep it at $95 until further notice. And that 75 pre-recorded tutoring series includes 190 questions plus that thoroughly break down and review all of those questions. I read all of the questions out loud, all of the answer choices. I tell you why the right answer is right, why the wrong answers are wrong. I help you to break down and pull out the relevant information in each question and put everything back together. I teach you strategies to learn how to pass the exam. There are 16 videos totaling about 12 to 13 hours. It's all at your own pace, and you have 75-day access. Any new information that's added during your access period will be given to you at no additional cost as a courtesy to you. There's no guarantee that more information and questions will be added during your access period, but if there is, you definitely will get it. Thank you for the work that you do. Make sure you document everything. And until next time, I will see you later. Have a great day. Stay safe and go forth and prosper.